there's a group out of the University of California, San Francisco, that's been doing work on childhood leukemia for now over 20 years. And what they found is that a variety of in utero environmental exposures to either pesticides, um, highway traffic, tobacco exposure from the father, paints and solvents, and pesticides all contribute to an increased risk in childhood leukemia. And they estimated that about 1 in 4 cases could be attributed back to one or more of those environmental exposures. Now, there's been other things as well. Since then, benzene appears to be a risk factor, as does proximity to fracking and oil development. Now, could that be in part benzene? Yes. So there may be some overlap, but those appear to be important risk factors for childhood leukemia. The interesting, or maybe the troubling thing for me anyway, is that we continue to put most of our research dollars into identifying ways to treat childhood leukemia and too little to try to understand more about ways to prevent childhood leukemia. Now, I've asked pediatricians, it was a hand raising survey at 10 different um, meetings around North America, uh, including New York University and University of Madison, Wisconsin, uh, the Canadian Pediatric Society. And I asked them the same question. How many of them would vote to increase funding to enhance the cure for childhood leukemia, which is arguably the poster child for finding a cure for cancer? And how many of them would increase funding to find ways to prevent childhood leukemia? That was very consistent across all 10 locations. What percent of pediatricians do you think voted to increase funding to enhance the cure for childhood leukemia?
I couldn't know because I didn't hear this story before.
All right. Well, only 5 pediatricians out of about 1,000 in the audiences voted to increase funding to enhance the cure, right? Almost all of them voted for more money to prevent childhood leukemia. Now, maybe that sounds like a surprise to some people, but treatment for childhood leukemia is daunting. It takes over families' lives for years. Uh, Other children are sort of neglected, right? And because there's so much need to focus on this one child. The cost, of course, is enormous. And so it really isn't a surprise. And I actually expect, nobody's asked parents this that I know of. I expect that parents would say something very similar, unless, of course, they had a child with leukemia. And then, understandably, they'd want more focus on treatment. Well, for those parents, we should ask a different question to be fair to them. Do they wish we had spent more on finding ways to prevent leukemia 20 years ago? And my guess is almost universally, we would put more money towards prevention. But if you look at where the National Cancer Institute in the United States puts most of its money, over 95% is on treatment, less than 4% for childhood cancer is on prevention. I don't
Yeah.
understand that, and I don't think if people were asked that they would understand it either.